Hello, everyone. My name is Janik Goryeb, and I am the Senior Health Education and Engagement Specialist at Brain Tumour Foundation of Canada. I'm so happy to have you here for yet another webinar of our 2021 webinar series. Our mission is to reach every Canadian affected by a brain tumor through the 4 pillars of our organization, which include support, information, education, and research. And this webinar series is really just one educational program that we do offer through Brain Tumour Foundation of Canada. So please make sure you go to braintumor.ca. You can make sure that you're signed up for any of our newsletters, or make sure you're following us on social media, because we post a lot about our events on social media as well. And even though our office continues to be closed during the pandemic, we are open through our 1-800 number and via email. So if you need support, have questions about ordering handbooks, have questions about any of our events, or about the fundraiser at Brain Tumor Walk this Sunday, feel free to call us or email us. And we've organized the Brain Tumor Webinar Series a little bit differently this year, in that we have 2 presenters for each webinar. Usually one's educational focus, and then a personal story of hope. So that's what we have today. And today we have 2 people joining us: Ilyse Lax, who's joining us from Toronto, Ontario, and Fatima Issa, a Canadian, but joining us from Michigan, USA. So love it when technology works. And you know what, Ilyse, I'm going to have you show your wonderful face. Hello, how are you? So I'm going to get Ilyse introduced here, and then we'll get going with your presentation. So Ilyse Lax was the rehabilitation consultant at the Pencer Brain Tumor Center at Princess Margaret Cancer Center in Toronto for 6 years before transitioning just recently to become the manager of COVID-19 vaccination this past December for Trillium Health Partners. This community hospital system is one of the hardest hit regions in Ontario. As an occupational therapist with years of experience working primarily as an occupational therapist with years of experience working primarily with people living with a brain tumor, malignant brain tumors, and their families, she strives to improve access to rehabilitation. Her passion is enabling people to move towards their own goals when health-related challenges get in the way of what they need to do and what they need to do and want to do. She is deeply involved in system change initiatives and facilitating coordinated care across sectors. As an adjunct lecturer at the University of Toronto Department of Rehabilitation Services, Ilyse contributes to the oncology curriculum and interprofessional clinical education, prompting her students to think critically about traditional rehabilitation models and question, what is rehab for people living with extremely complex and rapidly progressive disease? Ilyse's presentation is entitled, "It's All About Being Adaptive Rehabilitation When You Have a Brain Tumor." Brain tumors are their treatment impact people's functioning in diverse and complex ways. Although traditional rehabilitation programs are effective and gains are comparable to other populations, we see access and navigation issues. Patients, families, and providers alike need to be adaptive. Since brain tumors are an evolving condition where needs change as the disease progresses, we require an adaptive rehabilitation framework, which includes 3 things: an individualized approach, meaningful interventions, and right care at the right time. And I think Ilyse is going to be touching on all these points for us in her wonderful presentation. So thank you again for joining us, Ilyse. And I'm going to stop sharing my screen so you can share yours, and then I'll have you unmute yourself.
Wonderful. Well, thank you so much for that lovely introduction. And please bear with me as I attempt to share my screen.
Yeah, no problem. Take your time.
Okay, it's just letting me know that the host has disabled participant screen sharing.
All right, here we go. I'm
Okay.
that for you, my friend.
Thank you.
Make you co-host. It should work now.
Okie doke. Let's try this again. Beautiful. So with the magic of Zoom, we are well on our way. So thank you for bearing with us. Let me make sure that everything's set up nicely here before we launch on in. And maybe I'll have you just give me a thumbs up if things are looking okay from your side of things. Beautiful. Well, thank you. My goodness. I must say I'm someone that's still getting used to the virtual world. So I really do apologize that I'm a little bit computer illiterate these days. Maybe there's a couple of you still out there as well trying to figure out the world of virtual meeting, so thank you for your patience with me. I am absolutely thrilled and so honored to be invited to speak with you all today about an area that is truly my passion. I've been someone that has always tried to push the boundaries of rehab and what it looks like for people who maybe don't fit within the box of our very traditional models. And I have been incredibly lucky, as Yannick was saying, to be welcomed at the Princess Margaret Cancer Center over at the Pencer Brain Tumour Center, where I've worked with a team of phenomenal interprofessional clinicians who have really shaped my outlook. And I've been so privileged to work with a patient and family advisory committee that have very much shaped the way with which I practice and all of the information provided today. So although I'm the one that is presenting to you, certainly there are many people behind me in terms of the ideas that I draw upon and why I practice the way I do today. In terms of being a rehab professional, I've already made the assumption that some of you know what that means, and I don't want to start with any assumptions, so maybe I'll unpack that a little bit. Instead of helping people live longer, my focus is to really help people live better, and my jargon for that is helping enhance quality of life. So I like to say I'm in the business of improving people's quality of life. And I certainly have an interest in what draws other people into learning about rehab. So I know that we actually have a beautiful cross section from the poll earlier of who's joining us today. So feel free, jump in the chat and feel free to share why you're here today or potentially what you're looking to get out of this talk. So I'm just opening up the chat so that I can see it as well. Beautiful. So feel free to throw any of your ideas on in there in terms of what you're hoping to get out of the talk today. I'll certainly try to gear some of my comments and thoughts towards some of the information that's thrown in as comments are shared with me. Otherwise, certainly feel free to bring some Q&A forward at the end as well. So while we're sort of percolating on what we'd like to get out of this talk, I will let you know what I am planning on going through today. So in terms of our agenda, I would love to start off chatting a little bit about what makes neuro-oncology rehab unique. So starting a little bit about what is unique really here in the area of brain tumor rehab, diving into our bread and butter, enhancing quality of life, really looking at challenges, especially with traditional models, and then moving to adaptive rehab frameworks. So we'll walk through a true life example together, and also we'll go through a little bit of practice. When it comes to practice, I'm a little, as you've probably noticed, not the most tech savvy. So there will be a handout that will be sent around to everyone following our time together today that will really help us break down adaptive rehab framework and allow it to fit your own life. But certainly today, in lieu of the handout, if you have a scrap piece of paper, if you are a pen to paper kind of person or someone that likes to reflect in your own head, that's okay too. But just getting ready to think a little bit and apply some of what we chat about to your daily life. Wonderful. I'm already seeing some things jump on into the chat. Beautiful. Thank you. It's wonderful to see what you're hoping to get out of this today. So certainly we'll speak to some of the things that are already here in the chat, some things about physical abilities, some things about thinking skills and speech, how to cope with things like memory loss, and then how to better support brain tumor support groups when it comes to OT or rehab options. So certainly a lot there that we'll unpack together, and definitely don't hesitate. We'll also ask some of these concrete questions and dive into this during the Q&A. So we'll start off by appreciating what's unique. I always like to start here because truly a lot is unique. And I really don't want to pass over the complexity of rehab within the field of neuro-oncology. People with brain tumors have greater distress, lower positive affect, and more illness intrusiveness than people living with any other cancer type. Although researchers have made a direct link between high levels of functional impairment that people with brain tumors face, this does directly translate into losses of valued life roles and activities. I'll certainly say this one more time because this is the true core of what we're going to be chatting about today. People living with brain tumors suffer losses in valued activities and life roles, so participation, that certainly results in lower quality of life than people living with any other cancer type. So what is there to actually do about this? When we look at increasing health-related quality of life, we're really looking at improving the effects of illness on both well-being and participation. To create change and quality of life, we really need an approach that's both effective, so informed by evidence, research, and rehab theory, and also informed by what's meaningful to the individual. So when we think about the foundations of rehabilitation, it's really a very nice marriage of evidence-based practice with a very highly individualized approach. So before launching into a little bit about the current state of rehab and the landscape that exists out there, I wonder, what are some of the challenges that you've faced in your rehab journey? It may be your own journey, a loved one's journey, a client or a patient's rehab journey. Feel free to throw in the chat some of those challenges that you've faced, either when trying to access rehab or through your rehab experience. Okay, so some folks are looking to learn about rehab programs or opportunities that are available. So that makes me maybe think that things might not be out there or readily available for folks. Still trying to access programs, definitely. That can be a huge, huge challenge. Thank you. My goodness, I'm sure other folks feel similar. Anything else, guys? Feel free to type in the chat. No pressure. Okay. Well, that's certainly some food for thought. Thank you, guys. Okay. So I wasn't going to keep you hanging in terms of generating all of those different challenges yourselves, but certainly we can see some of the challenges that you wrote in the chat reflected here. Finding effective rehab interventions is certainly challenging. There's no decided framework for the integration of rehab into neuro-oncology care. In my opinion, there are three incredibly important reasons why we can't simply pick up and adapt an existing pathway of care or roadmap from other populations. And the first is functional complexity. So the complexity of people living with brain tumors. The fact that traditional inpatient and outpatient models of rehab are not always practical, not always sufficient. And a lot of you hit on this last point, that they're not always accessible. And certainly there can be significant change over time for some people as well. So the first challenge we'll dive into a little bit is complexity. So people living with brain tumors definitely present with a whole host of complex and heterogeneous constellations of impairment. So a lot of differences, often 3 to 5 functional impairments that you see listed here, people experience. So already in the chat, people were talking about things like challenges in physical abilities, challenges in thinking abilities, challenges with speech. Certainly quite diverse areas. It's not just one really targeted or specific thing that we're often looking for rehab on. And certainly when it comes to complexity, we're also talking about not just the functional impairments that affect daily life, but we're also looking into the things that are side effects of treatments themselves. So impairments can, on one hand, be due to the tumor location, and then certainly also can be a result of the type of treatment, dosage, and also side effects of other medications people may be on as well. So a good example when I'm really talking about the side effect piece is maybe swelling in the brain due to radiation. And I'm sure maybe some folks on the line have experienced that as well. So switching over to our second challenge, and definitely you guys were on the money in the chat when it comes to our traditional rehab models of care and accessing them. We know traditional models of care, inpatient and outpatient interprofessional rehab programs are effective. Significant functional gains are found, and they're certainly comparable to people with other brain conditions like a stroke or a traumatic brain injury, where rehab is quite established and a sincere pathway of care. But really few patients actually receive this care. Sometimes due to a lack of resources, perhaps an absence of rehab as an integrated component of someone's multidisciplinary pathway or treatment team, and isolation between treatment teams. There's definitely silos in our entire system of care across Canada. The third challenge that I'm going to speak about really is in line with an evolving condition. So the curve you see here really representing one acute event and then the gradual recovery of function is what most traditional rehab pathways are based on. So traditional rehab models of care are based on this curve with really remediation. So a fixing of functioning, for a lack of a better word, as its focus. But quite honestly, a lot of people don't have this one down and then a steady trajectory up. Most people experience a very bumpy road, especially for those living with quite aggressive brain tumors. And evidence-based practice definitely calls for services that can react quite quickly and then continue to provide input as the disease progresses and patients' needs change. So rather than exclusively focusing on remediation, or what I deemed fixing, a more flexible approach is really needed, where we also look at prevention of further functional decline, compensation. So I like to say compensation is doing things a different way. And for difficulties, sometimes people also need the right kind of assistance set up in their lives as well. So looking beyond remediation, rehab for people with brain tumors certainly has to look at prevention, compensation, and assistance as well. Okie doke. So now that we've talked about those challenges, gotten them out of the way, and thank you so much for throwing some of these really great ideas in the chat as well. That certainly spoke to that access piece and streamlined care. We're really going to delve into an adaptive rehab framework. So the challenges that we've spoken of really informed this model of care that is a little bit more of a flexible approach than what's normally used across the rehab spectrum. So really, given the complexity of the people that we serve, an individualized approach is absolutely necessary. And that's step one. We certainly need our approach to be meaningful to the person. So we definitely have to dive into what are the person's core values, understanding what's most meaningful in their lives. And then really our third step of an adaptive rehab framework is all about the right care at the right time. Within this state, we harness what's working in traditional rehab models of care, facilitate access when appropriate, but also we need to ensure that rehab is accessible and integrated into the entire care spectrum, not just simply after a major intervention like surgery. And third, we definitely need a flexible approach, because we know, given the complexity of people living with brain tumors, a one-size-fits-all approach really is not what we're looking at. And also we need to look beyond fixing, looking beyond remediation as our pure focus. So let's dive in. What do I actually mean when I talk about an individualized approach? So our first step of the adaptive rehab framework is really exploring the individual's concerns that are impacting on their daily life and quality of life. What I like to say quite practically is we're looking out for "I want to be able to" statements. If you're a caregiver, if you're a practitioner, you want to elicit these "I want to be able to" statements. If you are the individual, think about what are those things that you want to be able to do. These "I want to be able to" statements are really the person breaking down for you a situation in their life where there's now an satisfactory outcome, maybe for a couple of reasons, but normally it's a breakdown in the usual interaction that this person has between themselves, an activity, and the environment. So throughout my talk today, I'm going to refer to my friend Bob. Bob's name isn't Bob to keep his confidentiality, but certainly this is a real case, and I've received his permission to share it with you all today. So let's talk a little bit about Bob. Bob is living with a glioblastoma, and when I met him, he was recently diagnosed and undergoing concurrent chemoradiation. He's already finding that his physical skills are not quite what they were before. And Bob has a very slight hemiparesis, meaning one-sided weakness, and he has sincere balance issues. We're quite worried about his balance issues. And when chatting with Bob, he says, "I want to be able to mountain bike." So let's practice shifting attention from Bob to you. Grab your scrap piece of paper or think in your head, what is it that you want to be able to do or do more of? Just take a minute for reflection. Okie doke. So I don't want to rush anyone. Feel free to continue reflection. And for those that are done thinking about what they want to be able to do or do more of, we'll shift to our second stage of the Adaptive Rehab Framework. Our next step is really understanding what's most meaningful to the person. And this should really be guided by the person's own values. Values are what we find most meaningful in life, and they're really what you care about and consider to be important. Values are very different than goals, and certainly our values can change over time, particularly when we've faced a very difficult circumstance or a life-changing circumstance. Put crudely, goals can be achieved, whereas values are more like a compass, and you'll see the compass drawn here, guiding the direction we want to head in. For example, we may have the value, at least for me, I may have the goal of getting my children to school on time, which sits within the value of being a dedicated parent for me, or the goal of maybe going for a jog while placing potentially value on the importance of exercise and physical well-being. So shifting back to Bob, I get Bob talking a little bit about what he values most about mountain biking. One may assume that he found the most meaningful about the activity was maybe the environment, being away from the city, really enjoying nature, or at least that's why I bike. But when I actually unpacked what mountain biking meant for Bob, I actually learned that Bob has competed in races all over the world for the past 15 years, and he's done so with his son. Bob and his son are biking fanatics. Not only do they compete together, but through the week, they keep in touch by sending each other biking blog articles, cool new gear, recent training times. When I sat with Bob, he laughed in the way that people sometimes do when they're a little bit uncomfortable or when they're not quite sure how their next statement may land. And he told me he just feels more distant from his son since he stopped biking. They really don't even share blog articles anymore, and their communication now is mostly about transportation to and from appointments. His son separately tells me he isn't even sure if he could bring up biking with Bob. He just doesn't want to make Bob feel bad, and they can't do this together anymore. So let's practice. Let's think a little bit about core values, shifting from Bob to you. So you thought a little bit about an activity that you'd like to do more of. Let's think a little bit about the purpose behind that activity. What is really the why behind what you want to be able to do more of? Why is this activity meaningful for you? When it comes to core values, you might think of things like family, relationships, sense of productivity or work, maybe personal growth and development, sense of community or giving back to others. For some, maybe spirituality or faith, nature, creativity, fun, play, leisure, physical well-being. Maybe you really value independence, or maybe it's something that really contributes to your mental well-being. So just take a moment. That's certainly not an exhaustive list, but just thinking about maybe the value, the purpose behind the activity that you want to be able to do more of or do in general. Okay, again, certainly don't want to rush anyone. So feel free to linger on some of your core values if you are finding that reflection piece helpful. Otherwise, we'll shift on over to the third stage of our adaptive rehab model. This stage is the right care at the right time. And this is really where we identify opportunities for intervention. This step is all about what we're going to try or do differently. We want to ensure that we're targeting areas that are both realistic and in our control. I'm going to say that again. It's really not either or when it comes to what's realistic and in our control. It's actually both. We really want to think about intervening at levels that are both realistic and in our control, just so that we do not end up frustrated, hopeless. And we've all had moments in life where maybe we chose the wrong area to intervene, or maybe tried to really focus on something that was outside of our control. So when we're making these goals with a rehab framework, we really do want these two factors to come into mind. When we're thinking about the level with which we want to intervene, we can intervene at the level of ourselves as a person, or a patient or a loved one. We can intervene at the level of an activity, so what it is that we're doing in and of itself. And we can also intervene at the level of the environment, switching up where it is that we do the activity or adapting the environment, physically changing the place with which we do the activity. So I'll throw in a couple examples just to make this stage a little bit more concrete. It can get a little bit confusing. When intervening at the level of the person, we're often remediating challenges in physical or cognitive functioning. So a basic example of this is strengthening exercises when we have weakness. At the level of the activity itself, we can adapt an activity and what it entails. And a really basic example of this may be sitting on the edge of a bed to put on a pair of pants versus trying to do it in standing. And at the level of the environment, we can certainly add, take away, or completely switch up the area where someone is trying to do an activity. And a really good example of environmental adaptation is potentially putting a bench in a bathtub or shower. I'm going to go into some rehab lingo for those in the crowd that may be rehab or healthcare providers. You'll notice in thinking about the person, we're often using a remediation approach. And when we discuss adaptations to an activity or environment, we're certainly using a preventative and compensatory approach as well. So really weaving in some of the more flexible approaches, not just a fixing approach to our rehab. Okay, back to Bob. So where Bob was at, it really wasn't realistic for us to focus on remediating his balance and his strength. So we focused on adapting the activity and the environment, coming up with a realistic plan that was within Bob's control together. It turns out Bob's sister had a stationary recumbent bike she rarely used, and his son had an indoor bike trainer that he'd been using to simulate outdoor rides and train in the winter. Bob and his son both set up their basement attached to a race simulator. And quite quickly, Bob jumped right back into biking, his usual conversation and overly competitive banter with his son. So our last stage of practice together. At this point, you've gone through stage 1, where you're thinking about what you want to be able to do or do more of in your life. Stage 2, where you're really reflecting on why this activity is meaningful to you and making those core values really explicit, like for Bob, time with his son. And then the third is really all about what's both realistic and in your control. So the question here that you're really going to be thinking about, now knowing why this activity is meaningful for you, can you really think of what you can adapt that is both realistic and in your own control? Are you going to adapt something within yourself? Are you going to adapt the activity, do it differently, or are you going to adapt the environment? Taking a moment just to create a goal or a plan. What are you going to try? What may be that next step for you? Okay. So when it comes to the time practicing, reflecting today, I really encourage you to go back to these tools, especially when we're not as time crunched as we are in this moment. And certainly, if it seemed really fast to go through these pieces, I really do encourage you to explore the handout on an adaptive rehab framework once it's sent out after our talk together today. When it comes to an adaptive rehab framework, what's really important to know is we really need to address the challenges with our rehab system and traditional models of care head on. We do know that we need 3 things to make our rehab effective. The first is exploring the person's concerns that impact on their quality of life, an individualized approach, knowing one size does not fit all. The second step is understanding what's most meaningful to the person. So what are those core values that we're going to imbue in our plan? And the third is ensuring that the person has the right care at the right time, identifying opportunities for intervention that are both within the person's control and realistic at the level of maybe the person, the activity, and the environment. This takes a lot of practice, especially stage 3 when we're coming up with plans. It's a lot of creative drive to try to figure out what may suit me. What can I do that is both realistic for me and within my control? And that may take some time and safe exploration. And often that's facilitated by loved ones or even chatting things out with your own healthcare provider. I also always like to normalize this approach because quite honestly, we've all had a lot of challenge and change over the past year. And certainly when it comes to disruptions in routines and perhaps our usual activities and even participation in life roles, we probably all encountered a little bit of change there. So certainly taking time to recalibrate in line with what's most meaningful to us and what's realistic and within our control can certainly hold value. So what I'll say is this isn't just about someone who we may identify as a patient practicing these things. It's really up to all of us to normalize being adaptive, being flexible, being creative in how we approach living a meaningful life, and always trying to facilitate space for doing things a little bit differently. And I must say that might be something when it comes to really practical things. A couple of you threw in the chat some very specific, how do I do this, tips on that. So I've assembled a digital resource library, and I certainly think it may be hard, or I don't even think you can click on the screen to access it. So maybe we'll also send out this link or the PowerPoint um, thereafter. So you can easily access this digital resource library that has a lot of tools. If you're a professional, you can use some of these worksheets, tips, tricks with your patients, but also if you're someone that's looking for some tips and tricks for yourself, definitely you'll find a couple things within this resource library. And if you're a practitioner and you're looking for assessments, how do I actually measure this highly individualized approach? How do I assess if someone's making progress towards their goals? You can certainly use goal attainment scaling, which is really validated out there. But also here in Canada, we have a really beautiful assessment that a lot of people do use, and it is standardized, highly validated, and it's the Canadian Occupational Performance Measure that you can also see on this slide. So just a couple practical tips when it comes to executing rehab plans as well. What I will say is also feel free to get in touch, and you'll notice that my email is on this screen as well. In terms of our time together today, I know that it's been relatively short and there's just so much to talk about when it comes to the landscape of rehab. So I do apologize that maybe I didn't get to every piece, but certainly let's tackle some of your burning questions in the Q&A. And certainly I encourage you all, even if you're not by background a rehab provider, I really encourage you to think about how you can best advocate for non-traditional rehab approaches. We really do need to push our rehab into the 21st century and really put individualized, meaningful approaches first. For healthcare providers, I really hope that you may have found principles within this talk today that you can apply within your professional scope and context. It's made a little bit profession neutral, with the hope that regardless of what healthcare profession you are, there is something to tap into here. So thank you all, and truly thank you to the Brain Tumour Foundation of Canada for having me today. What a pleasure it is to be able to chat with you.
Thank you so much, Ilyse, for taking time out of your busy schedule to be with us, especially since you're not officially working in the brain tumor community world anymore. So we really, really do appreciate it. A couple questions did come through. One of them is, what do you think is the biggest barrier preventing access to rehab care for many brain tumor patients?
Oh goodness, this is a where to start question. Certainly, I'd say that we just don't learn about this in school. There's no textbook within the box, easy referral, check it off like a hip replacement. Um, Things are much more complex. In addition to that, we really often do not have someone with a rehab background on our teams. And that is something that we really do need to advocate for, because people often do have beautiful access to medical treatments, but where's the access to enhancing quality of life? So unless we see more and more rehab professionals sitting on teams, definitely that navigation piece is going to be an issue. And as well, I think knowing what to ask for is part of it too. I think, you know, the first thing you can all do that's both realistic and in your control is to put up your hand and certainly say to your treating teams, I'm looking for rehab, or I want to be able to, and use those statements very front and center. And sometimes we're actually surprised that that communication alone may actually unlock a door for us.
Mm-hmm. I really love the practical tips you gave in your presentation, Ilyse. And I think that that's, even though, you know, maybe we didn't get into like the nitty gritty of like, what is rehab? That is actually the other question that popped up. Can you provide maybe just some general examples of what rehab looks like for maybe some people with a brain tumor or a diagnosis?
Oh, certainly.
Yeah.
So examples are sometimes working on physical skills. So for someone like Bob, if he said, you know, weakness is the main thing that bothers me, and I have a one-sided weakness pattern. In the brain tumor world or neuro world, we call that hemiparesis. So we'd maybe do some strengthening activities, some balance activities, just to really scaffold those skills up. But if someone has the goal of just living more safely and independently in their home environment, it may be adapting their home environment so that they live on their own. They can more easily take care of themselves and operate as independently as they'd like to. And for others, it can be maybe things that are less tangible, like I want to be able to better connect with my family. And what that means is remembering how exactly to turn on this device and to be able to plan and organize my time. So how do we actually do that practically?
Mhm.
So it can be a number of different things, but it all really goes back to those I want to be able to statements. So where there's a breakdown in what you want to be able to do and what you're not quite able to do in this moment.
Yeah, exactly. And for some people who may or may not know, under the kind of the rehabilitation umbrella would include physiotherapists, occupational therapists, a speech language pathologist. Am I missing anyone?
Oh, those are definitely the
Those are-
core parts of the team.
Right.
And certainly often have social workers embedded
Of course.
on in there as well. It's such a wonderful backbone and beautiful navigators when it comes to system access.
Perfect. Thank you so
Yeah.
much. I don't think there's any other questions. Just somebody said here, we were put in touch with occupational therapy and physiotherapists when we actually told the oncologist the troubles we were experiencing at home. He could not tell from taking on a Zoom appointment when my husband was just sitting. So you just have to tell the doctor and ask for help. And we found them more than willing to help. And it was set up very quickly. That's great. Thank you so much for sharing that with us. Yeah,
That's
perfect.
really a wonderful comment of just how even asking a question and delving a little bit more deeply, even pushing your healthcare providers a little bit on that quality of life piece and those chats is certainly helpful.
Perfect. Thank you so much, Ilyse. Oh, sorry, one more question that just popped up. We were able to get our patient rehab arranged by the Montreal Neuro in Montreal. This was 4 years ago. My husband, the patient, was a bit frustrated as they got him back to quote unquote functional. But what more could we ask in reality? It took time for abilities to come back. I don't
Mhm.
know if you can.
That is a wonderful question. And you're exactly right. I think it is incredibly challenging because we have um, our normal for ourselves and then what may be feasible at different points in time. And yes, for some, rapid recovery of function within a particular window may be feasible, but for others, that's actually not. And we do have to kind of be realistic in that approach. And that's also never to say never. But when it comes to a more lengthy journey, it might not be a really intense window of rehab that we're looking for. Maybe we're just looking for a little bit of consultation and helpful pieces.
Mhm.
So maybe a couple exercises here. Oh, okay, we're doing a little bit better. Come a couple of months later. Okay, great. How are we going to adapt and push skills forward at that point? So everyone's trajectory looks a little bit different, and length of time is certainly one of those pieces as well.
For sure. Thank you so much, Ilyse. We really appreciate you taking the time. We know it's very busy with rolling out the vaccines where you are and all over the country. So we appreciate the work that you are doing during the pandemic. And we appreciated all the work that you did with our brain tumor community all those years while working at the Pencer Center at Princess Margaret Hospital. So thank you for your time. And we will chat very soon.
Thank you all so much. What a pleasure. Have a wonderful day.
You too. Take care.